please welcome to the stage Dr. Ken Berry, MD.
Let me ask you a question. How many of you have a relative that you love, grandparent, parent, brother, sister, aunt, uncle, who died from the complications of type 2 diabetes? Keep your hands up. A relative who lost a limb, a leg, a foot, a toe, is on dialysis, is blind, it has heart disease, has all of the complications of type 2. A lot of hands in the room. Now, hold on, let's pause. For the remainder of this talk, I want you to pretend you're American. Stop being reserved. I want to hear from you, okay? Think about that relative, or think about your friend who you've lost, who's gone now. They're in the cemetery. How many years of life could they have had? How many more memories? How many more birthday parties, anniversaries? How many more interactions? How much more wisdom could they have passed on to their children and their grandchildren? That's lost. That's gone. Was it lost or was it taken? Remember, you're an American now. Be big, be loud. Taken. That was taken. We just heard this excellent presentation by my friend Gary Taubes. This stuff's all documented. There's no way to equivocate. This is documented. It's been in the record for decades, over a century. It was taken from your family. Your family was robbed of that wisdom. Your family was robbed of the love that could have been given. The hugs that will never be. How does that make you feel? Sad. Initially sad. But now what? You crazy Americans? How do you feel about that? Furious? As we say in Tennessee, pissed off? Does that have the same meaning here? I'm not sure. I don't know. You should, and I want you. And so we're not going to be so much intellectual in this brief discussion. We're going to be emotional today. Because knowledge can protect you from the dangers of ignorance. But emotion spurs you to action. Emotion is what gets you up and gets you motivated, and you say, you know what, I'm going to go out in the world today and I'm going to make a damn difference. I'm going to change, this is wrong, and we're going to make it right. And we're all going to do it together. So I'm going to make an announcement here today. Some of you already know about this, but a group of low-carb physicians and I have gotten together, and we are creating this thing called the American Diabetes Society. And the reason we are doing this is because repetitively, many of us have reached out to the American Diabetes Association. And we've said, hey, there's a problem with your guidelines here. This is not helping people. Now, it's helping the pharmaceutical companies greatly. And it's helping the big food corporations. They're doing very nicely. But you're not really helping all the grandchildren and children who've lost someone, or who are going to lose someone. And somebody told me, you just need to keep publishing this stuff and just keep talking about this and let the ADA, they'll catch up eventually. And I said, well, okay, and there's someone who knows. I said, how long do you think it'll take before they're actively recommending a low-carb, very low-carb diet for type 2 diabetes? And how long do you think that'll take? And they said, it shouldn't take more than 10 or 20 years. Big wheels turn slowly. You've heard that, right? It's hard to turn around the Titanic. And so we know what happened to the Titanic. So what I would posit today is that, so on the board currently is me, Dr. Eric Westman, who you may have heard of. A doctor from Chicago, Dr. Tony Hampton. We have a registered dietitian, Michelle Hearn. Registered dietitian, Temple Stewart. And we have just received word that Dr. Mariella Glant is now on the board of the American Diabetes Society. We will be adding members. We're working on a website. This will be a nonprofit corporation that will be accepting donations. And so I was talking with a PhD researcher who has type 1 diabetes on Twitter, X. And he said, you know, I don't understand how you're going to get any traction because the American Diabetes Association, they put out the standard of care guidelines. And I asked him a question which flummoxed him completely. I said, how come they get to put out the guidelines? Is there some federal law? Did we vote? Did I miss an election? He's like, I've never actually considered that before. I don't know why they get to do that. And I said, you said it exactly right. They get to do that. They have no mandate. There's no legal mandate for them to be the ones that set the guidelines. And he was fascinated that he'd never thought of that before. And I think that we all are daily, if you're trying to be a thoughtful person, you're often fascinated with, why have I never thought of that? So, a little history. The American Diabetes Association was founded in 1939. There were 6 physicians at a medical conference. And in 1939, they said, you know, we should have an association just, you know, for people with diabetes, doctors who are interested. And they founded the American Diabetes Association in 1939. Just 6 doctors hanging out, having a coffee, I'm sure, with double sugar. And they said, let's make this. And so that's where the American Diabetes Association came from, and they now have a $100 million annual budget. And they set the standard of care just because they do, and nobody knows why. And so what we propose is a parallel association, organization, that will actually give good guidelines to help people reverse their type 2 diabetes and help people with type 1 diabetes have a normal A1C and 80% less chance of diabetic complications while using 80% less insulin. That's our mandate. And there are several things that we're going to do. We're going to be completely transparent. Financially, all board minutes will be posted online. All financials will be online, open to the public at 24/7, all the time. There will be no secrets. We will not take 1 penny from any big pharma corporation, ever. We will also not take 1 penny from any big food corporation that makes ultra-processed food. How does that make you feel? So what I'm proposing is that this is a moment in history that you all get to be part of. This is one of those moments. This is a revolution, okay? And we have multiple examples in history of revolution. There was a little revolution that took place across the channel. It kind of didn't go well. If you know your history, they were fully committed to burning it down or chopping it off. But that was they didn't have an alternative plan. The American Revolution, I find it fascinating that here in the UK, you guys don't really talk about the Revolutionary War. You call it something different. I'm like, what are you talking about? We totally kicked your ass. And you're like, yeah, actually, there's more to it than that. We had some other stuff going on. And I'm like, oh, okay. But the American Revolution, just please, humor me, okay? We had a plan. We said, you know what? We're going to burn down a bunch of stuff. But also, we're going to have parallel organizations and institutions. We're going to start our own government. We're going to start our own this, our own that. We're going to have a Congress. We're going to have, right? That's a rational revolution. Yeah, there's some stuff that damn sure needs to be burned down. 100%. The ADA being perhaps the number one thing. But for a rational revolution, you need parallel organizations that are ready to do the work, that are ready to put out the guidelines, that are ready to tell the dietary supervisor at a hospital, if you have a patient with type 2 diabetes as an inpatient, there should not be pancakes and syrup on their plate. You should have a society that tells the dietary supervisor at kindergarten and elementary school, kids' brains don't run on carbohydrates. So I would ask you to join me in this revolution. Be part of history. There are many parallel organizations springing up. The Public Health Collaboration, right? The Society of Metabolic Health Practitioners, the Citizen Science Foundation. This is a rational revolution. These are thinking people. We're like, yeah, we've got to have something to replace that with. We can't just burn it down and then go, oh, now what? Right? And so we're actively behind the scenes creating these parallel organizations that will take the place of the deficient associations we currently have. That's how we're going to change the world. You've been changing the world for years, watching my videos and Dr. Unwin's videos, and then teaching your mom, you don't need the sweets, okay? You're diabetic. You've been teaching your kids, this is a proper human diet. We eat our meat first. And then maybe you have something else. You're changing your world. Now let's change the whole damn world. Let's do that. So much suffering. So many relatives lost. So many photographs that could be in the family album that won't be in there now. You can't take that back. You can't get it back. It's gone. We cannot get those things back, but what we can do is we can honor those grandparents that went too soon. Honor the mothers and fathers that won't be at Christmas. We can honor them by saying no more. Enough. That's it. No more. We're not having it. We're not going to stand for it. We're going to change the world. And we're going to do it together.